Dear colleagues, embolization versus surgical treatment in pulmonary sequestration results of a retrospective multicenter study. The aim of our study is to evaluate and compare the results of embolization and surgical treatments of pulmonary sequestration in pediatric patients. There is still no consensus on treatment. 3 pediatric surgery units and 4 pediatric cardiological units were involved into the study. Patients younger than 3 years old who received embolization or surgical treatment for pulmonary sequestration between January 2010 and December 2020 were included. Data regarding preoperative workup, demographics, intra- and postoperative detail and follow-up were collected. All the procedures were performed under general anesthesia. Thoracoscopy was performed using 3 or 4 trachers, with the first one placed on the interaxillary line with an open technique. Percutaneous arterial embolization was attempted by transfemoral approach in all cases. An angiography was performed to identify the aberrant artery, which was cannulated and closed by Amplatzer vascular plug devices. 85 patients were included and divided in 2 groups. Group 1, thoracoscopy, with 51 patients. Group 2, embolization, with 34 patients. No difference were found in sex distributions and infra- and extralobar sequestration distribution. Prenatal diagnosis was significantly higher in G1 as well as symptomatic patients. There were no differences in procedure time and intensive care unit stay after procedure. Hospitalization was significantly shorter in G1 because 24 patients were treated as day case surgery. Conversion to open was necessary in 5 G1 cases. 3 hybrid lesions were found in G1 patients. 2 G1 patients were previously approached by embolization. In G1, follow-up was based on clinical examination and chest X-ray. Only G2 patients perform MRI or CT scan to check the complete involution of the lesion. At 1 year follow-up, 1 G1 patient requires surgical revision after 2 weeks due to an infected infralobar sequestration. In 1 G2 patient, it was impossible to complete the procedure, and the patient was addressed to the surgeon. All symptomatic patients become asymptomatic at the 1 year follow-up, but at the long-term follow-up, only 6 G2 patients perform imaging. 2 of them require a reintervention due to recurrences. Only 1 of them was symptomatic. In conclusion, we can affirm that surgery and endovascular embolization are both effective and safe treatment for pulmonary sequestration. The main difference is that surgical approach allows to remove the lesion, avoiding the need to monitor pathological tissue and its complete involution over time. Surgical approach, in our opinion, must be the preferential choice, especially in case of intralobar sequestration or doubt of combined lesion. Embolization must be used in case of severe shunt or heart failure, and in this case, we recommend a long-term follow-up supported by imaging. Thank you for your attention.